So welcome back to our series. We're session number 9, Booster Shots to Bouncing Back, Participative Management. We're very excited to have you all joining us, and you can go ahead and put in chat who you are and where you're from, what you do. And we just really have been wanting to introduce ourselves because sometimes we miss the opportunity to introduce our work. So we are IPRO, your QIN-QIO. It's IPRO Health Centric Advisors, or HCA, you may hear it. Clarence, and we are your QIN-QIO. We're here for you. If you have questions about infection control or quality improvement, how to run your CASPER report, we're here to help you with those types of things. And as a matter of fact, we're very excited. Josh is spearheading our new series. And so we are looking for questions from you. We are going to be looking at quality measures and basic quality improvement processes, how you look at your reports, what does a CASPER report mean, how do you run those? And so we are looking for you to go ahead and send in questions. What kind of questions might you have about quality measures, basic or difficult, and we can implement that into our new session that will be that we're working on. So go ahead, you can put them in chat, you can send them to us via email, but we'd love to hear from you because we're building these programs to meet your needs. So I'm going to turn it back over to Josh. Thank you, Josh, for joining.
Thank you so much, Melanie. So yeah, as Melanie had mentioned, we're the IPRO QIN-QIO. So if you know Health-Centric Advisors, you know Clarent, you know IPRO, you know us. We're 3 companies under the IPRO QIN-QIO. Although we're bouncing back from the boosters, I do just include some snapshot data of our booster rates for our residents and staff, just so that we can keep track of how we're doing. Next slide, you can see we're doing much better with the residents for the boosters than we are with the staff. We actually had a robust discussion last week on our IP3 session with the infection preventionists, talking about how it's been really challenging to get staff to get those boosters. So if you are interested in participating in the discussion and joining our IP3, we have those sessions on Thursdays at 11 o'clock. We'd love to have you there to, communicate with your peers, brainstorm ideas together, and really learn from each other. Next slide. So today we're going to be talking about participative management, which is part of the framework for improving joy in work. Next slide, please. So participative management, what is that? So participative management, otherwise known as employee involvement or participative decision-making, really encourages the involvement of your stakeholders at all levels of the organization in the analysis of problems, developing strategies, and implementation of solutions. So participative management really is a process in which people contribute to the solution of a problem, and is a management style usually that requires the cooperation of your staff. So building that commitment and developing the camaraderie to develop these initiatives, ultimately to work together as a team. So really, as a manager and leader, you really need to take a look at delegating some of your responsibility and power when it's necessary to have those teams decide together what solutions to adopt. Really important to create that trustful relationship between your employees and teams respectively, where the respect and collaboration from everyone is really emphasized. Next slide, please. I know a lot of leaders prefer to take a laissez-faire approach and entrust their employees with all of the decision-making power, while others may take sort of that authoritarian approach in which they hand down all the decisions right from the top. We talked about that a little bit last week with the hierarchy of decision-making, but participative leaders actually need to work and find that middle ground between those two extremes. And while there's a varying degree of participative leadership, generally speaking, we as leaders need to be acting as facilitators and providing and promoting members of the team and the group with the information and encouraging them to come up with solutions and gather input to ultimately make that decision. So next slide, please. So why is it important? So managers who actually use a participative style find that employees are more receptive to change in situations in which they have no voice. So changes are implemented more effectively when employees have input and can make contributions to the decisions themselves. And participation keeps the employees informed of upcoming events so that they will be aware of any potential changes. Additionally, the organization can then place itself in a proactive mode instead of a reactive one, as managers are able to quickly identify areas of concern and then turn to the employees for the solutions. So I myself, an administrator, I worked in a building a couple of years ago. And usually when that new administrator in the building, it's because something happened, or you need to go in and clean up all these messes and everything. And whether you're new to the facility or even have been in the facility for a long time, you can sometimes feel that you're spending so much time putting out fires that you never take the time to put out future ones. And if you're never preventing future ones, then you're always going to be fighting those daily fires, so to speak. Next slide, please. So there was actually a select group of leaders that were approached and asked a single question during a symposium on health systems. And they were asked, what key attributes of leaders create an effective health system? And the respondents were heads of health programs, directors of organizations, researchers, etc., leaders at different institutions. And a lot of the words that they actively used to describe the attributes of leaders were team player, knowledgeable, and adaptable. So although the respondents were identifying, individual leadership attributes, all those characteristics resonate through participative management, where you're talking about collective, shared, responsive, what's the word I'm looking for? Involvement of your teams, so that you're able to ultimately push them towards that, making those decisions collectively as a group. So, a lot of those keywords you hear all the time, but those are the same words and attributes that are needed for participative management. Next slide, please. So there's actually a lot of available literature specifically that's focused on the attributes of leaders to determine about what makes leadership a leader successful or failure. But among the literature that's available, there's a clear message that resonates across all of those things, all of those literature pieces. So even when you think of an accomplished leader who combines, valuables and commendable expertise, but functions solely as a decision maker, that way of thinking and performance is really sort of like an outdated model. There's now really a call for a model of leadership that engages and enables employees within the facility. And there's a need to develop a composite construct of leadership in healthcare, which is not limited to individual leadership, but one that solicits, facilitates, and enables greater participation from the employees themselves. Next slide, please. So participatory leadership is really exemplified when the group are empowered to contribute freely in different ways to effectively change your systems. So participatory leadership should also provide mechanisms for mounting those disruptive challenges to the status quo every day, as well as stabilizers within your organization to withstand internal and external turbulence of anything that might be coming your way within the facility. So when there's an opportunity for democratic debate and free exchange of ideas, a rigid hierarchical system in which authoritarian leaders would view this, they would normally look at it as sort of like deviant behavior or insubordination. But when you're building those systems of participatory leadership, when it becomes the norm, the system should ensure that the collective decisions emerge from healthy debate and would ultimately become the new norm to implement within the facility. Next slide, please. So within the Joy of Work toolkit, they talk about several components related to participative management, such as the responsibility to communicate using effective agreed methods. Everyone should be doing that. Listening, understanding, and involving your colleagues and employees in the decision-making process, whether that is a huge challenge that you need to solve, or even some of the small things that could easily be decided by one person. Get them involved in those conversations to elicit that feedback and have them be part of solutions. Always engage before you act. Involve others right from the start with whatever decision that you're making. Keep people informed and communicate your messages at different levels within a meaningful way. Know the strengths of each of your team members and how introverts and extroverts are different, but can also complement each other. And create those psychological safe spaces where people can come and hear and listen and act on any specific issues. Melanie, I don't know if you have anything else you want to add to this.
Yeah, I do. I was thinking about how can you really incorporate this on your day-to-day work? And I ask you all to consider, when you're doing a root cause analysis about an event that happens on the unit, are you bringing in some frontline staff? Is that an opportunity to kind of improve the participative leadership style that you've got? Or who's sitting on your quality improvement, your QAPI committees? Is there an opportunity to get some of your frontline staff in there? Not that I want you to be doing this, but if you're doing a plan of correction, or you've identified a performance improvement project, how are you incorporating the people that are going to be the end users into those decisions and writing your policies and procedures based on their thoughts and incorporating the actual function of the work? So those are some small things that I think are really helpful when you're developing to really bring that team into the development of different actions in the facility.
Perfect. Thank you so much, Melanie. Yeah, next slide actually. It actually speaks to what you were saying too about utilizing quality improvement and QAPI committee, and even your quality improvement tools to really create that shared purpose and objectives. Because when you're creating a shared objective, you're also pushing that shared responsibility where we're all responsible together as a group and can contribute to the solution of the problem. And doing these things can really embed a satisfaction and joy in work, because you feel like you're part of the solution and part of something bigger. Next slide, please. Again, so think about what we have learned so far in this series. We talked about physical and psychological safety. We talked about, hear me, listen and act on, experiences so that you can understand and address the concerns to the best extent that you can as leaders. And really, participative leadership really builds on those basic concepts that we talked about before about psychological safety and, truly hearing your employees and having them included and involved. Next slide, please.
Yes, Josh, I just wanted to add to that a little bit too. I mean, we talked about bringing this series to everyone based on such a struggle that you've gone through with COVID and staffing crisis and people leaving organizations, people jumping for 50 cents to the next door place. So we really were looking at how can we build and help put in some processes and procedures for you folks, or at least to give you some ideas of things that you can put in to help encourage retention and fulfillment and increase morale. And we definitely have learned, if you look at generational changes as well, doing the things that we used to do of what you have to do it because I said to, doesn't really work for the generations that we're working with. People need to understand why we're doing things. They want to feel value. Everybody wants to feel some level of value, and they want to feel like their message and their thoughts matter. So that, I mean, getting back, these are the things that we've learned, and we really know the staff want to be heard. So just wanted to throw that in as well.
Perfect. Thank you. So when we talk about participative leadership, there's actually a couple of different ways that you can go about and encompass that different type of leadership modalities for the decision-making style. So there's the consensus decision-making, which is, that form of leadership that gives employees the ultimate ability to determine the outcome of the decision. So, you as a leader might be able to act as a facilitator in this approach, but each employee is, ultimately voting on their preferred course of actions. And nothing is really happening until the team is usually able to reach a consensus. There's also collective leadership, which is the kind of leadership which involves a joint decision-making process in which the entire team is equally responsible for the process and the outcome. There's also democratic leadership, which is receiving input from the whole team regarding high-level decisions, but ultimate upper management really has the final say. So a democratic leader would be expected to explain their reasoning for the end decision. And then again, we talked about that autocratic leadership, where the leader welcomes the input from employees but maintains all the decision-making power. So although when we look at participative and democratic leadership, are those really, the same? So the terms participative leadership and democratic leadership are often used really interchangeably. And democratic leadership is the type of leadership structure that falls under the umbrella of participative management. And a lot of the characteristics are utilized from democratic leadership. And while democratic leadership itself still grants those in upper management the final say, one of the biggest advantages of that democratic leadership for participative management is that those in power are held in account to by their employees. So even though you're getting them to be part of the decision-making process, getting the input, you're making the final say. If your final say isn't, if your team says one thing and you do another thing, and it turns out what your employees said were right and we should have listened to them in the first place, you need to be held accountable for that too. It's like your employees are bringing the solution to you. So just keep that in mind as well. Next slide, please. So again, we talked about really a need to create that opportunity to really engage employees in a mutual respectful discussion to talk about the challenges and plan for concerted action to address them. Huge need, even now in today's standards within the facility. We need to start doing that. So next slide. The join work actually entails leaders to do actually a couple of things. So again, engage before acting. So leaders shouldn't be involving others in the beginning of stages of the initiative and explain why the work is needed and gain commitment before implementing any of the changes. Make sure that all your team is involved and on board. Inform them. So keep your staff informed of the changes or any future changes that may impact them. And then listen, which is probably the most important one. Hear me. We as leaders really should, constantly encourage colleagues to share and listen to the staff members at all levels of organizations, making sure that we consistently listen to everyone, not only when things are going well, but when things aren't going well as well. So core leaders really have that pivotal role of improving joy in work every day, every minute of every day within the workplace. We can work through your teams to go through different processes of identifying what matters, addressing your impediments that's preventing you from having joy in work, or the staff members having joy in work, and analyzing what is going well, what's not going well, and ultimately having the staff be part of the development of those strategies and co-create those solutions with team members. So participative management usually results in greater individual and team productivity, while also improving the process efficiencies. Next slide, please. There was actually a study on if participative leadership matters in employees' outcomes during COVID-19 and the role of a leader in behavioral integrity. So this study I can put in chat, I will include that right now. I don't think I have to send it to you afterwards. For some reason, when I link things in chat, it doesn't do it right, Melanie. So I'll connect with you afterwards after this to provide the link. So I just want to talk a little bit about the study. So their study actually highlights the role of participative leaders within linking it specifically to two important employee job outcomes, which is workplace thriving or joy in work, and helping behaviors. So their results actually reveal that participative leadership actually can nurture employees to thrive and find joy in work, as well as boost their behaviors so that they want to always be helpful to everybody. In addition, the study's findings also underline the importance of leader behavioral integrity as a potential boundary condition for participative leader effectiveness. So really interesting. The next slide, there was actually another project as well, where the Only Human project was, their objective actually was to develop a rapidly design and execute a behavior change campaign with the end goal of encouraging healthcare staff to proactively manage their own well-being while under the pressure of COVID-19 pandemic. So I know we're just sort of getting out of that, but those 2 years, even more than that now, 2 years of COVID has really done a number on our well-being, our nurses' well-beings, our CNA's well-being. Everyone in the facility has been affected. And we talked about self-care. We talked about a lot of these components in Maslow's hierarchy of needs in previous sessions. But what they did with this, as they actually had 8 interviews with frontline staff, or those who were supporting frontline staff during the COVID-19 pandemic. They spoke to many different people and really took this approach and had found that specifically teamwork and the peer support had trumped everything in COVID. So truly banding together was the only way that they was able to survive, getting through the pandemic. Melanie, I don't know if you have anything yet. I can link this as well for your follow-up email so people can take a look at, because there's the worksheet that you can evaluate and go and use on your own staff within the facilities that I think it might be interesting for the people on the call to do. Melanie, I don't know if you have anything else you want to add, or.
I think that during COVID-19,
You gotta get 2 headphones.
we truly have seen teamwork in the organizations. And I've said this before, I was a director of nursing and long-term care for the first year of COVID, and the teamwork that was identified and the way people managed, it was amazing. And we see that across the country. Certainly, this is an opportunity to learn from and continue. I mean, kudos to all of your staff that still are hanging in and working every day. And it's a major, so impressive.
Thanks, Melanie. So yeah, there was actually a fun group exercise where the nudge theory, where it was a campaign that took a peer-to-peer approach to prompt staff who were sometimes struggling to identify signs of stress in themselves, to try and spot early signs of stress and strain on their own colleagues, and then have them do simple actions such as checking in with those individuals regularly, making sure that they're taking breaks when they're supposed to, making sure that they're drinking water, really tackling those hierarchy of needs. And I can link that as well if people are interested in taking a look at the nudge theory and what that campaign entailed as well.
That sounds really interesting, Josh. I think recognizing staff burnout is imperative, especially in long-term care. Their work is so challenging, and sometimes the residents are challenging, and it can become very stressful. So recognizing staff burnout and people who need a break, it's such a great opportunity.
Yep. So that's all I have for today. I do know that there's a couple of comments in chat. Mary Jones had shared that we've really been in outbreak on and off since January this year, and it continues to be really exhausting for all their staff. Yeah, I can't even imagine what you guys have had to go through, not even just this year, but the past several years of COVID. I know, Mary Ellen, you worked through the pandemic yourself.
Yeah, and looking at the chat, it's difficult because the other work doesn't go away, even though COVID has taken over our lives. And as empathetic as you're trying to be, you've got a job to do too. But even asking in the gentlest way for some help with things, I've had nurses just burst into tears. Like that, and it wasn't that they were having a bad day. I just think that collectively, it's just like one more thing. And so that to me is the challenge. Is I get it, and how do we all move forward and get what we need done, and be passionate about what we're doing. It's very challenging.
Yeah, and I see Catherine had also put in chat, every level of the long-term care facility is stress, burnout is high. Yeah, no, we totally see that across the entire QIN, where I'd be working with an administrator one week, and then a couple of weeks later, it's someone different. Turnover between the frontline staff has always been challenging, but even leadership as well. You see it in our work, saying, "Hey, I know you, and now you're at this facility." It can be really challenging. So there are a lot of those links that I had mentioned that I can share with Melanie for our follow-up email if you'd be interested in taking a look at that. That nudge theory really was an interesting one to try to spot the stress and struggle and then identifying that in others. It can be really difficult to sometimes notice it in ourselves. So building that team approach where we're constantly, that nudge theory of looking after each other, and that's something that comes naturally to healthcare workers. It would be really interesting to hear your thoughts on next week, or if you're going to be participating in our IP3 this week.
Yeah, there's a chat that I have 2 nurses that have been here 20 plus years, ready to walk out. And we're hearing that too. Long-term employees, people who have been doing this a long time, they're overwhelmed and they're retiring. Also, I think also having empathy and getting people to put themselves into other people's roles helps. That's so important. It's very easy to start shift wars or department wars emotionally, but seeing their job as valuable and challenging is important as well. That's a really great point, Colleen. And I've heard of some organizations that actually have people kind of swap out and just experience what a housekeeper does for the day, or 2 hours, or somebody in dietary for 2 hours doing the tray line. What is that like? Just having that experience can enlighten people and cause maybe a morale boost. So we're at 12:32. We wanted to just let you know that we do repeat this series on Wednesday at 3:30. So if somebody on your team didn't join and you think it would be a good one to come to, have them join us at 3:30. Also, IP3 this week, we're going to continue with a conversation from last week and talk a little more with COVID challenges, because there's a lot of particular challenges and booster vaccine. So we're going to be talking about that. We're going to get to the peer-to-peer conversation to hear how people are dealing with some of those challenges. So very good conversation to join. If you aren't already signed up, get signed up. IP3 at 11. Also, we asked at the beginning, so any of you folks that joined us a little bit late, our next, Josh is spearheading the next project when the Bouncing Back series is over. We're going to be looking at quality measures and kind of blending it with the Casper report and the measures that are publicly reportable, and just kind of breaking it all down for you. So if you've got a question you've been dying to ask, now's your time. Send it into chat and we can answer those questions with our new series. We really want to hear from you, so we're offering what you need. And Mary Ellen, Josh, is there anything else you'd like to add today?
Just on the comment with Colleen about it being really easy to start shift wars or department wars. There was actually one facility that I had spoken with that had a take an employee to work day, where they had someone come in from a different department to work in a department that they don't work in, so that they can truly have a solid understanding of the responsibilities and the roles that that those team members have to go through. So it would really give them a much better appreciation. So I think that's something that everyone should try, and get everyone cross-trained as much as possible. I think is a good opportunity to really see the value of how we collectively work as a team, but also the different responsibilities we have. That's all I wanted to add.
Great, Josh. Mary Ellen?
You know that we did the same thing, a walk in the shoes initiative, and it was an eye opener. And the good thing about it was the CEO of the company participated too. And he talked about that for years afterwards. So try it. You might not see much from it, but the long-term effects, I don't know. I think there's something to be said for it.
Well, thank you everyone for joining. Thank you for those thoughts, Mary Ellen and Josh. We will be signing off. Have a good day.